Hey there, friends. I'm Dr. Nishikant Sharma, MD, and I welcome you all in my health and wellness YouTube channel. Friends, today we are going to discuss about OSA. What is OSA? Its full form is obstructive sleep apnea. Obstructive sleep apnea is a potentially serious medical condition which has been in spotlight since Bapilari's untimely death. Obstructive sleep apnea is a disorder in which a person's breathing stops and starts repeatedly during their sleep. It is dangerous because it can lead to heart attacks and paralytic strokes due to depleted oxygen levels. According to news reports, in a very unfortunate incident, popular singer and music composer Bapilari Cheese passed away recently following complications from OSA, bringing attention to a widely prevalent but underdiagnosed medical condition, obstructive sleep apnea. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. If you snore loudly and feel tired even after a good night's sleep, you might have sleep apnea. There are three types of sleep apnea. First one is obstructive sleep apnea, second one is central sleep apnea, and third one is a combination of both. What are the symptoms of sleep apnea? Loud snoring, episodes in which you stop breathing during sleep, which would be reported by a relative or another person, gasping for air during sleep, awakening with a dry mouth, morning headache, difficulty staying asleep, that is insomnia, excessive daytime sleepiness or drowsiness, difficulty paying attention while awake, falling asleep at work or while driving, irritability, and mood disturbances. Now, what are the factors that increase the risk of sleep apnea? Excessive weight. Obesity greatly increases the risk of sleep apnea. Fat deposits around your upper respiratory tract can obstruct your breathing. Neck circumferences. People having thicker neck might have narrower airways. Presence of tonsils and adenoids in the upper respiratory tract can obstruct the airways and greatly increase the risk of sleep apnea. Being male, males are 3 to 4 times more prone for obstructive sleep apnea than females. However, the incidence of obstructive sleep apnea increases in females after menopause. Being older, having family history of obstructive sleep apnea, use of alcohol, sedatives and tranquilizers, smoking and nasal conditions. All these are the causes that greatly increase the chances of you getting sleep apnea. Now, what are the complications of sleep apnea? Daytime fatigue, inability to concentrate. You will find yourself asleep at work. The incidences of accidents, motor vehicle accidents, and workplace accidents are more in people suffering from obstructive sleep apnea. You might feel quick tempered, moody, and depressed, high blood pressure and heart problems, sudden drop in blood oxygen levels can increase your blood pressure and strain your cardiovascular system. The incidence of recurrent heart attacks, paralytic strokes, and irregular heartbeats are more in people suffering from obstructive sleep apnea. Incidence of type 2 diabetes is also more in people suffering from OSA. If you are suffering from obstructive sleep apnea, please inform your doctor if you are undergoing any major surgery because the incidence of postoperative complications are more in people suffering from obstructive sleep apnea. It is an underdiagnosed disease. Many people who are suffering from obstructive sleep apnea even don't know that they are suffering from this disease. This disease has serious complications. If it is diagnosed early, it can be treated. And the good news is it is reversible and preventable. If you are suffering from any of these symptoms, please contact your physician as early as possible. Thank you very much.